wake up with your heart racing at 2 a.m.? No nightmare, no reason, just an uneasy, nerve-wracking feeling? You're not making it up. Let's break down what could be going on. Hi, I'm Dr. Val, an integrative sleep physician and women's sleep expert. For over a decade, I've helped women understand their sleep and untangle symptoms that often get brushed off, especially during perimenopause. Let's talk about why your heart races at night and what medical conditions could be causing it, but more importantly, what you can actually do about it. So what are heart palpitations? Palpitations are the feeling that your heart is fluttering, pounding, or even skipping a beat. But why do they happen more often in women, especially in midlife? Well, we are going through hormonal changes during this time. As estrogen levels fluctuate or drop, your heart's electrical system can be affected. Also, lower levels of progesterone, which is normally a calming hormone, can leave you feeling constantly on edge. Some palpitations are actually harmless, but not always. So let's talk about a few red flags. The first is atrial fibrillation, or AFib. This is an irregular rhythm that raises your risk of having a stroke. Alcohol, obesity, aging, and even undiagnosed obstructive sleep apnea can increase your odds of having it. Supraventricular tachycardia, or SVT, is a sudden burst of a rapid heartbeat that can feel like your heart is stuck in high gear. Things like underlying heart conditions, thyroid, or even genetics may increase your risk for this. Ventricular tachycardia or ventricular fibrillation are actually cardiac emergencies, and we see these in patients who have heart attacks or congestive heart failure. Also, low levels of electrolytes from vomiting or diarrhea can lead to things like magnesium, potassium deficiencies, and can affect your risk for having a palpitation or an irregular heartbeat. How about sleep? Sleep deprivation or just poor sleep quality can trigger your body's stress response and send your heart into overdrive. I always encourage my patients to aim for at least 6 hours of sleep a night. If you have obstructive sleep apnea, something that's often overlooked in women, research suggests that up to 90% of women who have OSA are not even diagnosed yet, because some of the symptoms women experience aren't the typical ones. We often have maybe fatigue, mood changes, night sweats, morning headaches, or waking up to urinate instead of the snoring, gasping, or choking. Sleep apnea can raise your risk of having high blood pressure, regular heartbeat, or even heart failure. So even if you're not a typical candidate, if you have a normal weight and you don't snore, still ask about getting a sleep study if you are experiencing some palpitations. Other people might ask, well, doc, isn't it just having a panic attack? Sometimes middle of the night heart racing could be a nocturnal or nighttime panic attack. And it can feel completely the same as other symptoms that may be a red flag. Chest pressure, waking up with a feeling of dread, gasping. Common triggers for this certainly are hormonal changes, changes in our stress and cortisol levels, or unresolved anxiety. While these may not be as dangerous, it's still important to figure out what's going on and get the adequate support you need. All right, ladies, what can we start doing today? Well, let's make it practical. Talk to your doctor about getting tested for obstructive sleep apnea, especially if you're feeling unrested or waking up with a racing heart. You can get a EKG, a Holter, some blood work, especially if these symptoms are frequent. Also, take a look at what you're eating. Caffeine, sugars can also impact your heart feelings and palpitations. Also, be mindful for your nervous system. Exercise daily, try breath work, make sure you're managing your stress appropriately. Heart palpitations aren't just in your head. However, they are common in women, and they are worth taking the time to understand what's going on. Don't panic, get curious. There almost is always a reason and also solution that can work for you. If you're looking for more support around women's sleep health and full living, join the Sleephoria Sisterhood on School. It's a free community where we learn, connect, and support each other on this journey through perimenopause. Until next time, I'm Dr. Val. Sleep well.